right here on KHEA. So make sure you share this out. Feel free to ask questions. We're going to be going live on the FM right now. Here we go. Good morning. This is KHEA Radio, 99.5 FM. This is Kickstart. My name is Gardy, and I have the honor and privilege of speaking with Dr. Philip Keiser about the state of everything going on. Good morning, Dr. Keiser. How are you today?
Well, I'm doing fine. How are you doing?
Thank you. I'm doing really good. So I have a bunch of questions I want to ask, and it's been a while since we've had the opportunity to speak, so I want to thank you right now just for making some time to come and chat on this Friday.
No, I'm happy to be here.
Yes, sir. So since we've spoke last, what's the state of the county? Like, what's going on right now?
Yeah, overall things are going very well. We still have a lot of COVID in the county. We have just a little over 3,000 cases that are active, but that number has dropped down. I think we reached a peak of about 10,000 cases sometime around mid-January. And then what we've also seen is that the cases are steadily decreasing. So every day we get fewer cases than we get new cases. And along with that, we've been vaccinating people like crazy. We've vaccinated almost 150,000 county residents to this point. And where 50% of the people who live in the county have gotten at least one shot in their arm. So we're well on our way to reaching our target goal of getting 75% of the people vaccinated before May, or by the end of May, I should say.
So whenever we reach that 75% mark, is that considered herd immunization, or is there anything? Why is that the goal?
Yeah, that's what we think. We think that's what we'll get herd immunity. We know about herd immunity with other viruses because we've reached it at other points, and of course, every virus is different, and we don't know how many we'll need. For example, measles virus, you need 95% of the people to get vaccinated before you develop herd immunity because it's so infectious. With the coronavirus, we're guessing somewhere around 75%.
Okay. And you also mentioned that 50% of the county, it's about 150,000 Galveston County residents, have at least had one of the vaccines. I know that there are different vaccines, and some of them, I think it's Johnson & Johnson requires one, and then the other. So what's the difference between those?
Yeah, well, they're made different ways. So the two vaccines we've been using are what are called RNA vaccines. This was a new technology that was developed, and initially none of us were sure how it was going to work, but it's worked extraordinarily well. One is made by Pfizer, the other is made by a company called Moderna. I got vaccinated with the Pfizer vaccine. And the Johnson & Johnson vaccine is the one-shot vaccine. It tends to be not as efficacious. I mean, you're more likely to get infected with COVID. But with all three of these vaccines, the risk of getting hospitalized or dying is virtually zero. And of course, that's what we're all about, right? We don't want people dying from this or getting real sick from it. So we rely on the state of Texas, who relies on the U.S. government to supply them with the vaccines. And quite frankly, right now, all the Johnson & Johnson vaccines are out. I was really surprised. We got an allocation of about 5,000 vaccines a couple weeks ago, and we went through that almost in one day. There was so much demand for it. We had a little left over that we took to some other places to vaccinate some of the homeless or other types of people that are difficult to find, and you don't want to have them coming back for a second vaccine. So we're still waiting for that second shots. Bottom line, all of these vaccines work. A lot of people ask me, which vaccine should I get? Which one is the best? And my answer is the best is the one that you can get in your arm. So, we're encouraging everybody to get vaccinated as quickly as possible.
Okay. And you mentioned that we were allocated or we were given some vaccines. Is that the U.S. government who kind of decides who gets what in the different counties?
Yeah, no, actually, it goes from the state. It goes from the federal government gives it to the states. And then in Austin, they have a committee that decides who gets what vaccines and how much supply. And so we've been fairly steady. We've seen our numbers go up since January, when we only got a few thousand, and now we're getting probably about 15,000 new doses per week. And we pretty much go through all of those every week. Although in the past couple of weeks, it's been getting harder and harder to get all our appointments filled. We have to do things like, call everybody, up, send out the flash news reports. Hey, we've got some extra, come on in. Mm-hmm. But when we do that, they fill up very quickly. So there's still a lot of demand out there for it. And when we see that happening, what that usually tells us is that the state criteria needs to change. And sure enough, they changed it last week so that come Monday, anyone over the age of 16 can get a vaccine. No questions asked, no medical conditions, no age requirements. Just anybody who wants one can get one.
Okay. So you mentioned earlier 50% of the county has had at least the first dose of a vaccine. What percent of the county has actually contracted COVID?
Oh, that's a good question. So, right now we're running at about 30,000 cases total, which is probably an underestimation of the number of the people that had COVID. Because, COVID's a funny disease. It ranges all the way from totally asymptomatic to killing people. And so we think that that number of people who have actually had COVID may be 1.5 to 2 times higher. So it may be 10%, it may be 20%, somewhere in that range.
So if people have already had a positive COVID test, does it make sense for them to go get the vaccine, or should they wait, or if it's available, get it?
Go get it. Go get it. I mean, here's what we know about COVID immunity that you get naturally. We know it wanes over time, and we know it's related to age. And we don't know how well it protects against future infection. So we see people all the time who have had COVID once before. They tend not to be serious cases, but again, most people who get COVID don't have serious cases. But one of the big things we're worried about right now is we're seeing all these different variations of COVID floating around. And so if people are not vaccinated and they get infected once or twice, then the COVID that grows out of them will maybe a little bit different, and eventually we may have one that evades the vaccines, and that's what we're worried about. So how do we get around that? We get around that by getting as many people vaccinated and having really high levels of immunity as quickly as possible.
So have the vaccines that we're currently using being effective on those changes where you were just mentioning with COVID if somebody gets it again?
Yeah, so far with what we have in the United States, that's true. So there's what they call the UK variant that came from the United Kingdom, from Great Britain. There's a South African variant. There's even a California variant, go figure. And there's one from Brazil. We don't know very much about the one from Brazil, but some scientists at UTMB have tested the other ones, and at least the Pfizer vaccine and presumably the other vaccines provide protection against those variants thus far.
So what's the best place for people to go and sign up? Is there a way to do it from your phone, a website? How do they do that?
Yeah. So right now, basically, we want to go to www.utmb.edu/vaccines. Okay. Right now, as of today, there's a waiting list, but we're going to do away with the waiting list because we're finding that fewer and fewer people are using it. And as more vaccine gets available, people are finding different ways to do it. So come Monday, we're going to have what we call open scheduling. So basically, you go to that website, you click on it, it'll tell you where we have vaccines available and what times. You just click on it and then you show up.
Okay, one thing that I love about living in Galveston County is that we have a very diverse population. With that being said, there's a lot of people that are not English speaking, or that's not their first or strong language. Are there any efforts being made to kind of support our Galveston County residents who are not fluent in English?
Yeah. So we're working on getting Spanish translations on this. We're also working on outreach to people in the Hispanic community. That seems to be one of our biggest issues. When we look at the wait list of people who signed up for it, where we see people, not quite filling it out right, or people we've had problems reaching through that wait list, a significant portion of them have Spanish last names. So we know there are language issues out there, right? And we want to reach out to those folks. We're also reaching out to the African American community. We're going to be going through churches and talking to pastors. We found that's a really good way to get people that are reluctant to get vaccinated, is to hold an event at their church, because then what it is, it changes the whole dynamic. It's no more, oh, do I do this? And then it makes you feel very much on your own. But people that are doing it. Someone will say, hey, come on, I'm going to go get vaccinated down at the church. You want to come? And in those cases, we don't even have them sign up. We let the churches do that. and they identify the people and get people out, and it's worked extremely well. So you're going to see a lot more of that as more vaccine becomes available, and more vaccine is becoming available. You'll see the drive-through that we have. That's probably going to go away, and not right away, but that's probably going to go away in the next 6 weeks or so. And hopefully people will be able to get this wherever they want, and at their doctor's offices or at pharmacies. But if they can't get it there, what we will do is we're going to continue our outreach efforts. We're going to continue to work with communities, community centers, maybe have some things stuffed up in parks and other places, work with churches, work with other groups to make sure that everybody who wants this vaccine or even thinks they might want this vaccine will get it. That's our goal.
Okay, so when it was first rolled out, it was rolled out to if you were over the certain age or you had health issues. Yeah. A lot of people may fall into that demographic, but they aren't able to be mobile. What is there anything being offered, or is people like me, I guess, encouraged to go check on your neighbors and see if you can help them make that plan?
Yeah. So a couple things. So we actually have a homebound program, and we work through home health agencies and actually go out into people's homes for people who can't get out. We are talking about doing things like going to some of these not retirement homes, but assisted living places for where elderly live, and going out to those places. If you have a relative who's hard to get around, I'm telling you, the drive-through is a great thing to do it. You can sign up yourself plus grandma and drive them through, and you can get the whole family vaccinated all at once. And so that turned out to be a really great way to get people who aren't necessarily homebound and locked in their homes, but people who do have mobility issues. They don't have to get out, they don't have the car, they don't have to walk upstairs, they can have it all done inside their car. So we're trying all sorts of these things. One of the things you got to realize is that we vaccinated half the county in about 2 months. So, this was done not perfectly, but we succeeded in our objectives, and we learn every time we do it about some ways that we could do it better. And we also learn every time we do it that there are holes, and we need to work on filling them.
With it taking 2 months to vaccinate half the county, and we're trying to get to that 75% mark, when do you estimate that we'll be able to make that happen?
We're hopeful at the rate that we're going. So getting to the 75% mark means that at 50%, we're more than halfway there, right? Even though it's 50%. And we base that not only just on where we want to be in terms of getting people immunized, also we base it on polls of people who want to get the vaccine. About 50% of the people want it, about 25% of the people aren't sure, and about 25% of the people say, no, I don't want it at all. And that's fine. We're not trying to make anybody get something that they don't want. But since we're over halfway there, we're probably about 2/3 of the way there. If we keep this pace up, and if the demand keeps up, we expect to be there probably before summer.
Okay, and you were we were talking about how it's going to be open. I think on Monday it's just going to be like, hey, everybody, you're allowed to sign up, right? As that happens, is there going to be more opportunities in the day? Because I think of someone who was a shift worker or somebody who works all day and they just can't. They can't take off or go wait in the line. Is there going to be other opportunities?
Yeah. So we're going to be looking at ways to have appointments later in the evening. But we also expect, this is what the governor's office has told us, is that there's going to be more vaccine available. So we don't expect to be the only people given vaccines. So the way we think this is going to look in the next 3 to 4 weeks is not only are we doing our mass vaccine efforts, but you're going to find your local pharmacy, you're going to find your local doctor will have some. You may want to check, and they say, we've got 100 vaccines, come on in. The other thing we're thinking about doing is looking at things for specific types of things, like you say, like shift workers, but particularly hospitality workers. They often work long hours and can have difficult things. So we're going to be talking about setting some stuff up so they can come and get their vaccines.
Are there any other challenges? COVID or not COVID at all, are there any other challenges that we're facing at a county that we need to get the word out about?
Well, right now things are everybody's really happy. I would tell you that continue to think of us and pray for us, because this has been a long, hard road. We're tired, and we're not done yet. But things where if people want to volunteer, we can use volunteers at all sorts of levels to help get things through. Obviously, we're coming up against hurricane season, and that's something that I think everybody needs to be thinking about. We had the ice storm, which pretty much took us all by surprise and shut things down. But part of the reason we want to really push to get this done before June 1st is that hurricane season's coming up. We had early hurricanes last year, and we want to make sure that we can be ready for that as well. And right now, quite frankly, vaccinating is consuming all of our time.
Is there anything else that you'd like to share this morning on KHEA Radio?
If you haven't gotten vaccinated, go ahead. Now's the time. Don't worry about your age. Don't worry about your risk factors. If you've been thinking about doing it down the line, now's the time. If you're worried about that it's going to harm you, I can tell you that we've vaccinated over 100,000 people so far just in our county alone. And in our hands, we have not seen any severe reaction. I got vaccinated in December as a healthcare worker. And you can see my head hasn't fallen off. I haven't grown a horn. I was really hoping my cell phone reception would improve, but that didn't happen either. So, these things are as billed and they're very, very safe. So come on in and get vaccinated.
Thank you so much for joining today, Dr. Keiser. I appreciate you.
Okay, thanks.
This is KHEA Radio, 99.5 FM.